their will place. So still, I would like to say that since Covaxin is a platform based mainly on the influenza vaccine, even the adjuvant they've been using the same. They've been using aluminum phosphate. So Covaxin is absolutely safe, and we should go ahead and take the vaccine. Now, the next scenario is a woman who's pregnant, has been exposed, and after 5 days of screening, she has been detected to be COVID positive. Now, how do we manage this kind of? How do you manage, and what do we do in this? So, in these patients, first and foremost, I would like to say, please do not panic. 85 to 90% of COVID infections in pregnancies are either asymptomatic or mild. Now, whom would you call an asymptomatic patient, and who would classify into the mild category of COVID positive patients? Asymptomatic obviously means she has no symptoms. Then, coming to the mild category, people who have mild infections would have cough, fever, mainly upper respiratory cough, fever, cold. Their oxygen saturation would not drop beyond 95%. The fever usually goes off within 5 days, and it is now not high grade. They again shall be self isolating, keeping themselves well hydrated, eating well, and taking the general medications which are prescribed for common cough and cold. You can again take in good supplements to increase your immunity, and do some deep breathing exercises. Now, when are these patients to ask for help from the provider? They are to ask for help if their respiratory rate increases more than 24, if they are having persistent high grade fever in spite of taking paracetamol, if the fever persists beyond 5 days, or if the oxygen saturation is showing less than 94%. These are the indications wherein you have to alarm your healthcare provider and get admitted. Now, what is from mild to moderate is any person having these symptoms. That is high grade fever, oxygen saturation less than 94%, a respiratory rate more than 24 per minute, or persistent cough which is not settling down. These are patients who have moderate infections, and they are to be admitted in the hospital because they would require some amount of oxygen supplementation. Severe patient obviously would be a person with a respiratory rate more than 30 and oxygen saturation less than 90. These are patients who would probably require the non-invasive ventilations. So during pregnancy, mostly 99 to 95% people are either asymptomatic and mild infection, and they come out easily. Now, coming to the effect of the disease on the woman and on the child. So first I would like to talk about the effect of disease on the woman. So if you talk about the disease per se, whether pregnancy would increase the incidence of a person going into severe disease, yes, it does, but a little bit. Pregnancy is an immunocompromised state, so it is possible that a woman having COVID positive status in pregnancy would have a slightly higher chance of going into moderate or severe disease during pregnancy. But the chance is very little. It has been documented in various reports to be more than around 2% to 5% increase more than in a normal woman. So again, I would say it is nothing to panic about. Generally, people do not go into severe or moderate disease. So suppose a patient, then again comes the question that what about patients with moderate disease? Even patients with moderate disease come out, do not have many side effects. The guidelines for treating patients with asymptomatic patients obviously do not need any treatment, and they can come out 14 days, 10 days after they have tested. Rather, the latest Omicron guidelines say 7 days after being tested positive for the disease, and usually 10 days after having symptoms. Even for the mild patients, they can stop their isolation 7 days after testing positive and 10 days after having symptoms, whatever is the latest. Then coming to patients with moderate disease, and coming to people with asymptomatic disease and mild disease, what effect it would have on their child? There have been slight increased incidence of preeclampsias and preterm labors in patients with mild disease, but it has been very little. Mainly the effect of COVID on pregnancies on people with moderate to severe disease. Patients with mild diseases or asymptomatic patients generally would not have any effect on the child. Again, on the child, even in the moderate diseases or the severe diseases, the only effect that COVID causes on pregnancy is increased incidence of preeclampsia, increase in the preterm labor, and obviously if the disease is very severe and there is maternal respiratory acidosis, then obviously it would have its further effects like MODS and renal failures, liver failures, and intrauterine fetal deaths of the child. But that would be very severe diseases and occurs very rarely. So patients with moderate diseases generally do come out. Regarding medicines, steroids have been recommended, but again, I would like to stress people with mild diseases should not be taking steroids. They are not required to take remdesivir. There is no role of ivermectin. There is no role of hydroxychloroquine. These all roles have been completely, they have been stopped in patients with, for prophylaxis, they have been completely stopped, and patients with mild diseases do not need to take steroids. It is only patients with moderate diseases who are admitted in the hospital need to take remdesivir and corticosteroids. And that would be only under hospital care. None of it is to be done at home. And there is no role of favipiravir also in patients with mild disease. So mild disease patients just need to take care of their health, eat well, hydrate themselves. They can take medicines like cetirizine. There is again no role of antibiotic because this is a viral infection. This is not a microbial infection. They should maintain their hydration, eat well, that is all. And they would generally come out in 5 to 6 days out of the symptoms. And moderate diseases is to be managed in the hospital. Severe diseases always obviously need multi-speciality care. So the patients with moderate disease and severe disease, steroids and remdesivir. There is a role of tocilizumab also in patients with moderate diseases and severe diseases. Now, these are the patients where the child would also be affected. As I said earlier, there would be increased incidence of preeclampsias, preterm labors, and in patients with very severe diseases, even intrauterine fetal deaths have rarely been reported. But that is because of the maternal respiratory condition that the child is being affected. And now, also coming to the fact that when do we deliver these patients with mild diseases? So patients with mild diseases should not prepone their delivery. They are to be delivered in whatever the obstetric indications are, they deliver in that. And it is preferable that if the patient has been exposed to the virus and is positive, you delay the delivery till 14 days so that the child develops when the mother develops the antibodies, she would be transmitting the antibodies translucently. Now, when I say this, there again comes the question whether the mother having the virus would actively transmit the virus to the child translucently. There have been a few reports that there has been only 1% incidence of transfer of the virus translucently to the child. Then again, another big question is, do we do a vaginal delivery or a cesarean? Now, what the data says is that there is very little virus in the vaginal secretions. So we can do a vaginal delivery, but the fecal secretions are very high in the virus. So when we are delivering vaginally, we have to make it sure there is that to prevent infection to the child, there is no the fetus is not touched by the fecal matter because the fecal matter has a very high rate of viral multiplication. So yes, vaginal delivery can be done with a lot of precautions in patients with mild diseases, and preferably the delivery is to be not to be taken place if the obstetric indications do not take place till at least 14 days after they have tested positive for the virus. Obviously, the severe and moderate cases are to be done in the multi-specialities, and the indications to deliver have to be taking into consideration the mother's health also. But again, in moderate cases, it is better that once the mother improves, we deliver the child. In severe cases, they have said that there is no such study which directly states that delivering the fetus would improve the maternal condition. Although we as obstetricians would generally believe that once we deliver, the diaphragm comes down and the rate of the maternal breathing would be better. But the studies have shown that there is no such data which can say that delivering the child would improve the maternal status of respiration. So obviously, the time of delivery of the child is purely obstetrical again in the severe cases. Now, coming to postpartum, the woman should breastfeed her baby if she is actively infected or has delivered within 14 days of getting a positive result. She should breastfeed, but she should be taking adequate precautions as in sanitizing her hands, wearing a mask, and not unnecessarily touching her baby. Ideally, the best thing would be that she extracts her milk after wearing a mask and sanitizing her hands. And if there are other help, if there are other people at home, they can feed the baby with a Pallade feed till Pallade till at least 14 days of her being positive. But if that is not possible and there are not other people, then she does breastfeed, but she does not, after that, she should keep the baby a little separate and she should not be unnecessarily touching the baby. And if she's in the same room, she should always be wearing a mask when she's there with the baby around. Transplacental spread of the virus to the baby is only 1%. From the vagina, it is hardly there, but fecal transmission is there. Breastfeeding does not transmit the virus to the child, but yes, your handling the child would transmit. Now, generally, coming to the neonates, generally the neonates behave very well with the virus, but yes, still to protect them, there have been a few incidences of congenital infections. Where generally the kids have done very well. Now, I would like to transfer the podium to Dr. Anil to talk about anesthesia during COVID times.
Right.
And labor management.
Thank you, Dr. Sandeep, for a nice talk. Thank you, Pratibha ma'am, for a nice talk. I'm Dr. Anil. I'm Senior Consultant in Anesthesia in Cloud9 Hospital, Noida. So basically, as we all know, we are going through a pandemic and everybody is apprehensive about the well-being of their patients during this time. And everybody is apprehensive about the management of medical services which are non-COVID related. And our pregnancy is among one of that services, right? So we are going to talk about the management of pregnancy in the third trimester. Suppose if the patient is landed in cesarean section, as already told by Dr. Pratibha ma'am and Dr. Sandeep ma'am, that the patient per se has no indication for going to cesarean because of COVID per se. But if there is any medical indication and the patient need to go for cesarean section, then we need to do little of preparations. Why we have to do all this? Basically, our basic aim is to make a safe delivery, as well as we have to protect our healthcare personnel also with the exposure of this virus. So how to go along with this? First of all, we have to do the screening of all the pregnant mothers who are planning the deliveries in a day or two. So all the pregnant mothers where the gynecologist is thinking about the delivery in a day or two, we are going with the RT-PCR test. We are not recommending antigen test nowadays because the antigen test has a very low sensitivity. And RT-PCR test in any form, either in RT-PCR or TrueNet or CBNet, is recommended within 2 days of the delivery. Now, again, we can broadly classify the patient into two categories. One whom this COVID RT-PCR is negative, and other is who are COVID negative positive. So, in the patient who are RT-PCR negative, again, if the patients are asymptomatic, we might have that feeling that they might be positive, which is falsely showing negative by RT-PCR, as it has a sensitivity rate of only 65 to 70%. So we have to be a little vigilant about those patients also, and we have to keep that patients also in the isolation. In the patient who are COVID RT-PCR positive, again, the Dr. Sandeep ma'am have really classified it quite nicely that we can broadly classify them into according to the disease. Most of the patients, luckily, in this wave are asymptomatic, which we are getting are asymptomatic. Other might be having mild disease or moderate disease or severe disease. Fortunately, we are not coming across any moderate or severe disease in this wave per se. So we are talking about the patients who are COVID positive and or a high level of suspicion of COVID positive, despite having RT-PCR negative. So how to go along with them? If the gynecologist decided to go for cesarean without because of some medical indication, then we don't need to be panicked. You have to be you will be better given that care which you are needed. It's not that the care will be compromised because of the COVID thing, but yes, we have to be little vigilant so that the infection will not spread to others. So how to go along? Whenever we have planned that we are going for the cesarean, we always shift the patient to isolation ward in our hospital. So there's isolation ward where we keep our patients who are COVID positive or is high level of suspicion of COVID positive. And from the ward, the patient, after the proper investigation, proper workup, we shift directly patient to the operating room without any gap in between. And patient is advised to wear mask all that time. Also, we used to recommend attendant who is either asymptomatic COVID positive or uh, with very mild symptoms to accompany the patient. The attendants who are having moderate and high symptoms are not recommended along with the patients. So once the patient is wheeled inside the OT, proper donning of the healthcare worker need to be done so as to prevent the infection. We request pregnant ladies to wear mask all the time during the cesarean section. It is just to prevent the cross infection. So proper donning requires wearing of PPE kit, N95 mask, face shield, goggles, boots, gloves, which we used to do just outside the operating room. And now, as the choice of anesthesia is concerned, as we all know that COVID-19 is a aerosol generating disease. So we want minimum aerosol generation during the surgery. So spinal anesthesia is preferred over general anesthesia in this case because spinal anesthesia has hardly any aerosol generating procedure. Whereas general anesthesia does have a lot of aerosol generating procedure. So we don't recommend general anesthesia unless it is indicated. If spinal anesthesia is contraindicated with for any reason, then definitely we have to go for general anesthesia. Then the care will be little more. And once the baby will get delivered, as Sandeep ma'am already told, if the patient is having less symptoms or asymptomatic, we start breastfeeding in the OT itself, but with proper care. Mother need to be touch the baby only after hand hygiene as hand sanitization. And if the patient is moderate or severely symptom, we don't allow breastfeeding and we shift the baby to the isolation alone, right? And once the surgery portion will be over, we shift patient directly again to the isolation ward if the patient is having mild or asymptomatic. If the patient is moderate or severely symptomatic, then the patient require a high care, which can be provided only in ICU setup, where in a tertiary care setup where the ICU backup is there. So in those cases, we shift patient to the ICU or HDU according to the need of the patient. Patient might require some invasive ventilation or might require some BiPAP support. According to the need of the patient, according to the symptom of the patient, we plan further management. But in the operating room, patient, because we are seeing mostly asymptomatic and mild symptoms, patient, we have to just take care of the cross infection, which is very important. And also the mother need to be counseled that this is not a very big thing. The care which we are going to provide you is not going to compromise because of this COVID-19. It's just like another flu, which has high rate of transmission in this wave. So I just want to say this. With this, I will go to Dr. Pratibha ma'am. If any questions?
Yeah, now we can have the questions, Shweta. The questions are posted in Q&A window. Shweta, please coordinate and direct the questions to each one of us.
Yes, ma'am. I have shared the questions on the chat box.
Okay. How do we open it? Right.
Okay, I can mention the query, ma'am.
Yeah.
The first query is, I am on day 149. How active do I need to be to facilitate normal delivery?
Now you are on day 149, which means roughly you are about 5 months pregnant, if I am not wrong. You can, don't worry because of COVID. You will take all precautions to prevent to get COVID infection. And you will carry on with your deep breathing exercises and all other exercises and pregnancy yoga to keep yourself active as well as to facilitate normal delivery. At the same time, if in case you get infected in this third wave, you don't have to worry. You will just continue your yoga, you will continue your meditation, adequate sleep, high protein diet to keep yourself healthy and to maintain your immunity, and you will gradually recover and carry on with your pregnancy as normal as ever.
Second question is to Sandeep, ma'am. I have posted it on the chat box.
I can't see.
Okay, I will read the query out. I am
pregnant. Will my husband be allowed to enter the labor room? How many people are allowed in this room? Ma'am, ideally, yes, we do encourage patients and their attendants to be in the labor room if they are having normal delivery. But in this COVID era, we generally avoid overcrowding and we want as little as possible people in the room because there could be asymptomatic infections which could be transmitted to your husband also. So it is preferable that in considering the COVID situation, your husband does not come in. But if you so much require him to be there, then if both of you are COVID RT-PCR negative, we can allow the husband.
Audio बहुत खराब है.
Hello, am I audible?
Yes, ma'am, you are.
Next question.
Next question is for Dr. Anil. Is it possible to have 100% safe delivery during the current time?
Look, there is nothing called 100% safe, but yes, in this way, this disease is very mild. We are taking it as a normal flu with high infectivity rate, as I've already told you. So only the patients who are having moderate or severe symptoms because of some pre-existing problem should be taken care in a tertiary care center. Otherwise, patient with age, mostly patients which we are encountered are asymptomatic in this pregnancy. So yes, there is 100% safe delivery protocols, which if we are following the safe delivery protocols, there will be 100% safe delivery. Chances are there, near about to 100%.
Pratibha ma'am, next query is, hello, I am 37th week and I sometimes feel nausea. Is it normal during this stage? Please advise.
Yeah, at 37 weeks, that means you are nearing term. Nausea is very common. This is basically due to a reflux of the acid, and we call it as a reflux gastritis. It is mainly due to hormonal changes in pregnancy, plus with the increasing bump and upward pressure of the uterus and slow gastric emptying, more secretions are formed and they go upwards and cause nausea. In that case, you can always consult your treating obstetrician or take simple things like pantoprazole along with Domstal to prevent reflux and to reduce your nausea. This will help you in keeping well and also to eat well.
Yes, Dr. Sandeep, next query is, how can I be stress-free during this time when I am pregnant and my delivery date is coming close?
So obviously some amount of meditation, some amount of positive thinking, doing what you like the most, and your partner helping you. These are the methods you can stay stress free. Where positive thinking plays a lot of role.
I will like to add at this point that every patient who is much stressed and nearing the time of delivery, they should sit with their obstetrician, discuss about the setup as to how they are going to deliver, if they are positive or negative, see the place around and feel convinced that they will be handled safely and they will be handled well at the time of delivery. So don't increase your anxiety making queries in your own mind. Go to your obstetrician, discuss with them, go to the healthcare facility, discuss with the management people over there, and be convinced that you are in safe place and in safe hands. We can go to the next question, Shweta.
Yes. So next question is for like, hello doctor, I am in 38th week of pregnancy. I tested positive for COVID. What do I do if I get pain or my water breaks? What is the procedure for COVID patients?
Dr. Anil, will you take up or should I answer
Okay.
this?
Yeah, ma'am. If you have to consult your obstetricians, as I've already told you. If you are asymptomatic, you just talk to your obstetricians, and they will get you admitted in an isolation room as you are COVID positive. The symptoms are not there, or you are having very mild symptoms, then you can get admitted, and we will then do all the workup required. And if we are planning for normal delivery, I would definitely recommend for epidural analgesia for pain relief. Reason being, as I already tell you that this procedure, this COVID infection is because of amount of aerosol generation. So obviously, because of this COVID, patient is already depressed, and because of this pain, when the patient has that panting, then the chances of spread of infection is more. And because of this, COVID patient is already depressed, and because of the pain, if that depression and this negativity will increase, definitely that is not going to give a good outcome. So I will definitely recommend epidural analgesia for such patients. And if we are going for a cesarean delivery, then, as I have already told you, we are keeping you in an isolation room. From there, you are shifting to the separate OR, which is also isolated, which is not used for other patients. And from there, with using all the barrier methods for the universal precaution, your baby will be delivered normally. There is not a big problem once you will become COVID negative. If you don't have increase in symptoms, then definitely according to the pediatricians, uh, it's pediatrician domain. Basically, they will allow you for breastfeeding, and if the symptoms will get increased, as already told earlier, that the breast pumping will be done to extract the milk, and that milk will be given to the baby, because there is no contraindication of breast milk in this COVID time.
Thank you, Dr. Anil. Pratibha ma'am, the next query is, hello, I am 15 weeks pregnant. Can I go for COVID booster dose?
Yeah, it is much recommended. Government guidelines are very clear that COVID vaccine should be taken during pregnancy because it protects you from getting infection. If you have had 2 doses and you are due for booster dose, pregnancy comes under a high risk group and the booster dose is being recommended and being given. Only that the guidelines say that you should have completed 39 weeks from your second dose. And once you are 39 weeks, you please go ahead with your booster dose so that you are safe in rest of your pregnancy.
We are getting the same query again. Do you allow birthing partner or husband in the labor room?
I think I've already answered this.
Yes, I'll take the next one. I am 19 weeks pregnant. I have a feeling of hardening just above navel. So is it anything I need to take care, or it is normal in pregnancy?
Some degree of hardening is normal in pregnancy because they are natural contractions of the uterus, which are called Braxton Hicks contractions, but they are not painful, they are not frequent, they are infrequent, and they are not associated with pain. If you have some hardening, it is better to get yourself examined by your treating obstetrician to find out, are you tending to go into a premature delivery? Is this pain related to your uterus or not? Or it is merely an intestinal colic which is causing you discomfort.
Okay, thank you. The next query is, in a C-section, do we get skin to skin for the baby and mother immediately? And is husband allowed to cut the umbilical cord?
Dr. Anil, to please
No,
take
no,
up this question.
we normally in this COVID time, we are not allowing husband. We don't want to, as if the mother is COVID positive, we assume because of the close contact with the mother, the husband will also be COVID positive. So in COVID scenario, we don't allow husband to come inside the OT to increase the chances of infection. As far as skin to skin contact, as I already told you, if you are asymptomatic and we are allowing skin to skin contact, but if you are having symptoms, we are just preventing it, and it's all will be done once you will become asymptomatic, not in the OT. You are symptomatic.
Dr. Anil, the next query is, hello, I am now 27th week pregnant. I have my growth scan on the 27th of Jan. Is it completely safe to go for my growth scan?
Yes, you can go. I think ideally the routine visits should be minimized as possible because this decision has to be taken by obstetricians. How frequently it need to be done about growth scan, obstetrician will be able to tell more better. But definitely the visit should be minimized as much as possible because the chances of infection is very high. The visit should be minimal.
Yes,
If it
I
is
would like
required,
to.
only you have to go for scanning, and then that decision will be taken by your obstetricians.
I would like to say something on that. The guidelines are the visits have to be as little as possible in uncomplicated patients. Suppose you're not having hypertension, you're not having diabetes, then the visits have to be clubbed in such a way that the vaccination, the ultrasounds, and the growth parameters, everything can be seen in one visit, and then the patient can take up video consultations ahead. So they have to be minimized, but in a complicated patients where we are suspecting IUGR, hypertension, diabetes, or there's some other complication to pregnancy, it is better to go to your visits as advised by a treating obstetrician.
Thank you. We have another query. How safe and recommended is epidural analgesia?
As
This
as
is
I've
Dr.
already
Anil.
told, this epidural anesthesia come under regional anesthesia, and in regional anesthesia there is hardly any chances of aerosol generation. So it is safe for the hospital personnel who are working along with there, and it is very good for the pregnant patient. As I already told, because of this COVID infection, lot of negativity is spreading in their mind. Lot of they are already in very much of stress, and this labor pain increases stress to little more extent. And once you will get a relaxed environment for birth, giving delivery, you will be definitely appreciated over it. And epidural is very safe, it should be taken. It should be ideally taken, and it will definitely give you some positive feeling while delivery.
Thank you. I'm just checking
Completely
queries.
safe.
I'm checking for any more queries. Just give me a minute, please.
Meanwhile, ma'am, if you want to say something.
I'll just add to Dr. Anil's statement of epidural. Epidural is actually very important and it is very essential. And I always feel that all girls who are planning a normal delivery, once they go into active labor, they should opt for epidural. Now, when the labor pains are increasing, the girls are extremely anxious. They are not able to bear the pain. So epidural gives them a pain relief. It reduces the anxiety and hastens the labor. At the same time, I feel that with less anxiety, even the baby does well, the fetal distress is reduced, and it helps them to achieve a normal delivery in an easier manner. Now with COVID time especially, to avoid panting and having the stress of labor pains, epidural certainly helps in achieving a normal delivery with minimizing the complications of COVID infections. Often girls are asking us whether I should go to a multi-speciality or to a single specialty like Cloud9 Hospital. I want to tell all of you that if you are COVID negative or if you have mild symptoms and COVID positive, it is always beneficial to be in a single specialty hospital because there you are given individualized care. There is no risk of infection from other patients of other departments like surgical department, medical department. The staff is not getting over from one department to another department. There is no risk of getting infection from the staff or the healthcare workers, and even from doctors for that practical purpose. We are completely safe and we are not at any risk of transmitting the infections. But on the other hand, girls who are sick, who are symptomatic, or they have underlying health problems like respiratory diseases, as I said, or they are diabetic or cardiac diseases, they should definitely opt for multi-speciality hospitals where there is a complete infrastructure with ICU, cardiac facilities, ventilator facilities, and all the intensivists are there to handle them in case they get more sick. So therefore, one can always discuss with your obstetrician, discuss the various options available in their healthcare facility, and then plan the place of delivery. Do we have any more questions, Shweta?
Thank you, doctor. Yes, we have few more queries. I'll just quickly put them across.
Okay.
So for epidural analgesia, they are asking, are there any side effects after delivery?
Dr. Anil, may I please take this question?
Yeah, ma'am, please. Okay, so epidural anesthesia is an invasive procedure. We put a catheter in your epidural space. Every invasive procedure has some side effects, but this side effects will not increase in COVID infection. They had hardly anything linked with COVID infection and epidural. In general, if they are asking about the side effect of epidural analgesia, yes, there are few side effects of epidural analgesia because we are using local anesthetic for the pain relief. There could be allergy to that local anesthesia, which is common to as all other drugs which are used in allopathy. Every drug has propensity to cause allergic reaction. Same is with local anesthetic also. They can cause infection. If the accidental dura puncture is there, there is a chance of mild, slightly higher chances of headache post delivery. But all the side effects which are there because of epidural analgesia and epidural anesthesia are transient. They are not long lasting. It's not like that effect will last after 10 days also, 15 days also. If the headache is there, it will persist for 2-3 days after post delivery, and then it will be subsided because we have to intervene. Either it will be subsided on its own, or we have to start with some medicines to get it subsided. So there is side effect like allergic. If allergy will happen, that will happen during the course only over there in the OT itself. That is not going to happen after 10 days. So all the side effects which are there are side effects are there, but side effects are very minimal and that are very transient. It's not a long lasting side effects. And it is not because of COVID that side effects has been increased. It is the same which was earlier.
Thank you, Dr. Anil.
It's a very safe procedure otherwise.
Sure. Next few queries are similar. I will answer, just ask them all, and you can have the. So it's about if a mother unfortunately becomes COVID positive, will the fetus get affected? And if yes, how and what will be the risk? A similar query, I contracted COVID-19 at the start of my 7th month. I had mild symptoms and completely fine now. How do I know my baby is all safe? Movements are fine and baby seems active. Currently 30th week running. And a similar one, I got COVID during a 4th month of pregnancy. Will it affect my baby's growth? And one doctor suggested to take aspirin. Will that help?
So I would like to answer this question. First and foremost, transplacental spread of COVID occurs in only 1% of patients who are near term and who have severe disease. So both these patients, or rather all the three patients, have had mild disease or have been asymptomatic. They have not had infection near term. So it is almost unlikely that the baby is going to be affected. As for monitoring is concerned, the recommendation is that after you have had COVID, 21 days after you have had COVID, you should undergo a growth scan. That is what the guidelines say. After you have been free of COVID, 21 days after you have been free of COVID, if you are in the early trimesters, or 14 days if you are in your later trimesters. As far as aspirin is concerned, low dose aspirin in patients with moderate COVID is recommended. Asymptomatic patients or mild patients with mild symptoms, aspirin is per se not recommended in pregnant patients with COVID. For indication of COVID per se, if she has any other indication, she can go ahead and take it.
Sure. Thank you, Dr. Sandeep. Looking at the time and in interest of time, I will just mention last two queries, and after that we can wind up. So the next query is, I'm 32 weeks pregnant. I'm having rib and back pain and becoming more breathless. I have low placenta but no cervical stitch. Should I choose a harder bed as mine is a soft, or using a firm cushion for the tummy will help? Will soft bed cause early delivery or complications? And the last one is again with respect to COVID. I'm 23 weeks pregnant, tested COVID positive with mild symptoms, recovering right now. Will there be chances I get infected again before delivery?
So generally it is, if you have already tested COVID for positive and you have come out of it, you have become asymptomatic. So the next 90 days, it is very, very unlikely that you're going to be infected with the same variant because your antibody levels are very high. And as far as the bed is concerned, definitely hard beds are better, but there is no study which says that soft bed causes preterm labor. It does not do so. It just in a soft bed, the posture of the back is not straight, so you have more tendencies to have backache.
Sure. Thank you, Dr. Sandeep. Thank you, Dr. Pratibha, and thank you, Dr. Anil. So we are done with queries for now, and thank you for all your insights and much needed and helpful session for the community today. Thank you very much. Anything more you can please mention, and then we can close the session. Thank you so much.
I just want to add that we can ensure the apprehensive mothers that this time the COVID is not very severe. Don't get depressed if you are getting COVID infection. Just follow the normal protocols, inform to your obstetricians, be in touch with your physician and anesthetist, and that will definitely assure you more safer deliveries. And the chances of complications is very less. Stay positive. Once you are positive, you have fight with the disease almost 50% of time by
I
remaining
agree with
positive.
Dr. Anil fully. Please enjoy your pregnancy and look forward to the arrival of Bundle of Joy. Wish you all the best for your pregnancy and delivery. Thank you.
Yeah, same here. I hope you have a healthy baby and a safe pregnancy. Thank you so much.
Thank you very much. Thank you very much. Thank you for your time.